New this morning, another tool in the fight against COVID showing some promise. Merck announcing their plans to submit an emergency application for authorization for their COVID-19 pill called molnupiravir. If approved by the Food and Drug Administration, the company's oral COVID-19 antiviral medicine could be the first for COVID. An interim analysis found that the drug reduced the risk of hospitalization by 50%, hospitalization or death. This is the first pill form of treatment for COVID. We've seen other treatments, but up until now they've been through IV or injection. So let's talk more about this pill and some of the other COVID headlines this week with Dr. Ernst von Schwarz. Dr. von Schwarz, good to see you again this morning. Is this Merck pill a game changer for treatment?
Well, it could be. There's another one actually on the market, not on the market, but under development from Pfizer too. So the Merck study was stopped prematurely by an independent advisory team because of not bad outcomes, but just the opposite, good outcomes. So a 50% reduction in severe disease and death is a major thing, and that could be a game changer, absolutely. We don't have any oral medication to treat COVID. So again, this is possibly a medication to treat patients with COVID. This is not something to take as a preventive measure up front.
So people that already have COVID may be in the hospital with it, or their doctor could see that they have it. They give them this pill and the symptoms start to get better?
Once it's FDA approved, again, that's a possibility. Absolutely, yeah.
That's so interesting. Another big topic this week has been pregnant women and vaccination status. What's the latest update there? I know the CDC is really pushing to get more pregnant women to get the shot.
Absolutely. I just came from the hospital, Joey. I have a 34-year-old pregnant lady on a ventilator with COVID right now who has not been vaccinated. So it's a disaster to see that. I mean, those people are now on several IV drips, and those medications, they have deleterious effects for the mom and the baby to be born, of course. So less than 1/3 of all pregnant women have been vaccinated in this country. And we know that the pregnant women have a double risk of getting really sick with COVID, a 70% risk of dying once they get into the hospital. And many of them end in the ICU. So there's enough data available now that, number one, the vaccine doesn't cause infertility, which was one of the issues initially, and people were not sure about that. And number two, there's absolutely no evidence whatsoever that the vaccine causes any congenital defects or birth defects.
And women that are pregnant, is a booster shot something that maybe is something they should be looking into with their doctor?
Well, so far we don't have any recommendation on a booster shot, but women who are pregnant can and should get the vaccine at any time during pregnancy, and women who are might to consider becoming pregnant, of course, should get it before they become pregnant. But any time during pregnancy, even in the last trimester, that's a possibility, and definitely better than getting COVID and getting really sick.
And then finally, we seem to be on the downside of this latest peak when it comes to COVID. What are we seeing? Obviously, California's been doing better than the rest of the country, but even statistics nationally are starting to come down.
Yeah, in California yesterday we had 562 new cases, 12 death cases, which is a 2.4% decrease compared to the week before. So overall, we see less patients coming to the hospitals, less patients in the intensive care unit. So finally, those numbers go down.
Dr. Ernst von Schwarz, thanks for joining us and providing some clarity on all these COVID headlines for this week.